Okay, so to get started, first I'll introduce myself. A lot of you know me. We've worked together for a while, but I've seen some new names in the list. My name's Robin Smith. I am an outreach specialist at AFMC. I've been working with the IQI program since 2009. So it's kind of my baby. So I take pride in it, and when things don't go well, kind of like our new AMART system, it hurts my feelings. But anyway, so that's me. And what we're going to do today is we're going to go over the criteria for the 2019 program year. We're going to go through the criteria. I'll go over the changes for that. We'll go through our specifications manual over the few changes that we have there for this year. There are a few changes in the Joint Commission data elements for the OBS mother and the OBS newborn questions. And then we'll go through and I'll answer any questions that you guys have other than what we ask as we're going through. And that's what we're going to do today. So I'll get started. Let me get down here. So our introduction, we have actually been doing the IQI program since like 2009, I believe. So we've been doing it for several years. And this year, we're going to look at 7 performance measures this year. I think we had 8 performance last year and 1 submission. But this year we've changed it up. We're going to do 7 performance measures with 2 submission measures, and then we'll still have 1 outcome measure, which is the same, and then we'll have the same 2 structural measures. Our criteria here is the same. You still have to submit on all of your eligible measures and have a minimum of 5 cases per eligible topic for your 3rd and 4th quarter of 2018. You have to pass 80% of those measures, and you'll see this in your thresholds below on how you'll do that. If your measure denominator is 0 after data analysis, you'll not be eligible for that measure. And then you also, along with passing those guidelines, you have to also pass validation. Your bonus payments for those hospitals who do get a monetary bonus, this shows you how that is calculated. You'll receive a 5.8% of your per diem or up to $50 per day on Medicaid primary discharges, excluding dual eligible beneficiaries and those under 1 year of age. For the hospitals that are not eligible for a bonus payment, which are your critical access hospitals, they are still able to participate. They just receive recognition when they meet the requirements. Your performance measures for OBS 4, 5A, 6, and 9, which that's your elective delivery, your observe and assess breast milk feeding, C-section and first-time moms, and providing advice and education on breastfeeding, and then also on your tobacco 1, 2, and 3 measures and OP10. These are your measures that you have to perform on this year. You meet 1 of 2 thresholds to pass a measure. So your threshold 1, you have to be at or above the 75th percentile compared to last year, which would be quarter 3 and quarter 4 of 2017. We do have some exceptions there. Your OBS 4 has to be at least 3% or below. Then that's the same as it was last year. OBS 6 must be 22% or lower, which is the same as last year. OP10 has changed. This year, OP10 has to be 6% or lower. And these are all for your combined quarters 3 and 4 of 2018. To meet threshold 2, you have to achieve a 35% reduction in your failure rate. The exceptions on here are the same as threshold 1, but we've added in OBS 5A and OBS 9. They must have their performance must be 25% reduction in failure rate based on last 3rd and 4th quarter of 2017. Tobacco, the performance of 50% minimum must be achieved to qualify for passing. And then for OBS 5A and OBS 9, we need a performance of 50% minimum. It was 40% last year, so we've raised it up a little bit this year. Our submission measures this year, we've got our behavioral health screening 1, which is the screening for suicide. I'll have to read it. And then OBS 5, the exclusive breast milk feeding. We did move that to a submission measure this year. So for hospitals to pass that measure, all you have to do is abstract and submit 100% of your newborn population and pass validation, and we pass OBS 5 this year. BHS 1, we did change. We've made that your ED population. So, last year you just had to send in a notice of intent to implement or your policy on suicide screening. Well, this year we're actually going to abstract charts, and you'll submit a sample. You can sample this one since it is your entire ED population. And in this copy of this manual that I'm looking through, I can send you guys this at the end, but I've highlighted some things and made some notes here on the side for the changes. So like over here, I've got that BHS 1 is changed to the ED population this year, and it will be abstracted and validated as a submission measure. And then OBS 5 is submission, and everything that I had told you about and being able to pass OBS 5 is there. So I can send this version of the manual out to you guys after the call if you guys want it. Go down to our structural measures. OBS 8 and HIV 1, they're staying the same. The only thing we've done, we've kind of made the questions a little bit different, but they're not impacted in any way. We're still looking at your numerator as the number of moms who were screened for depression during their stay, and then the number of moms with an HIV status documented prior to delivery, and then your denominator is all of your mothers who delivered. So there are no changes to those. Our sampling requirements are the same as last year. Still have to do 100% of your OBS population, so that's all of your moms and your newborns. We do, provide you guys with that monthly list of cases to abstract. That is based on Arkansas Medicaid paid claims. So that number is going to look different when we give it to you, because we may only give you 12 moms and you had 45 in a month or something, but that's because we pull what has already been paid. So that's why those numbers look different. Validation, same as last year. We're going to pull 2 randomly selected charts from each topic per quarter. So we'll have a third quarter validation time frame and a fourth quarter validation time frame. We're not going to validate OP10, OBS 8, and HIV 1, just like last year. To pass validation, a combined score of 80% across both quarters is required. So, and I have to say, everybody does actually pretty good these days on validation. I'm really proud of you guys. Here's just a little table that shows the number of measures that we have for the year and the number of measures that are required to pass. So if your hospital provides OB services, you have 12 eligible measures, and you're required to pass 10 of those to pass the program. My little note here for those that do not offer OB services, you have 5 measures this year, and you're required to pass 4 of those 5 to meet that 80%. And then down here is just a list of your measures. I'm not going to go through those. You guys can look at those when you have time. But I'll open this up now for if anybody has any questions regarding the criteria.
Robin, can you hear me?
I can.
Hi, it's Denise from Baxter Regional.
Hi, Denise.
Hi. Do you know when will we have our thresholds for fiscal year 2019?
We will have those after we finish with 2018. I'm hoping to get all of that stuff finished up next week. And at the end of this, I was going to tell you guys that all of the participation and registration information is going to come out around August 17th. So I'll probably have those reports before then. So just be looking for those over the next week or so.
Okay, great. Thank you.
Let's say week to 2 weeks, because
okay.
I can only do so much. I have other people that I depend on. But yeah, I'm working on it. I'm trying to get everything done.
I know it. Thanks, Robin.
You're welcome. Any other questions about the criteria?
Robin, this is Linda. Did I miss what the sample size will be on this behavioral health in the ED?
That is going to be, you will be able to sample it, and it's going to be probably just like your tobacco, since tobacco covers all of your, basically everybody as well. I'll have to see how she wants to do that, but it's probably going to be similar to the tobacco. And what we'll do is we'll load in your minimum sample size, and then you'll be able to choose the number that you actually want to abstract.
Thank you.
You're welcome. Okay, well, I'm going to mute everybody. Actually, I'm going to leave you guys open because I feel like I'm talking to myself if I have you guys muted, and I don't like that. So we'll move on to our manual. These are measure information forms and flowcharts. This is the part of the manual that just basically gives you all of your information regarding a measure, your population size, your included population, who is excluded from the population, that kind of information. It shows your data elements and those kinds of things. And on each one of these measure information forms, I've put a little note at the top. If there are any changes or whatever inside a measure information, I have a note. So this year there are no changes to our perinatal care initial patient population. So this is for your OBS 5, your newborns. So we don't have any changes on how we determine who those babies are. And we'll get down here. So OBS 4, this is your elective delivery. If we look at the note, we don't have any changes to the measure information form or flow chart, but there are some changes to the data elements for abstraction, and I'll go over those when we get down to the alphabetical data dictionary. But see in here, this shows, your included population shows your diagnosis codes, your procedure codes, and all of these code tables are listed in the back of this manual for those of you who are new to the IQI program. We do show that there's no one that's excluded for this measure. All moms are included, and that's for the numerator. All moms are, for the numerator. And then we have our data elements. So we have our procedure codes, labor, prior uterine surgery. And then we have our denominator statement, and that's all your moms delivering with equal to or more than 37 weeks or less than 39 weeks of gestation completed. And then we've got our included codes there for our population, and then our excluded populations, and then our data elements. So this is how our measure information form works. And then right here, I've put an abstraction resources link. Basically, all this does is link you back to either the Joint Commission Specifications Manual or the CMS Specifications Manual for the alphabetical data dictionaries, where you will actually be doing the abstraction from. So that's here, and then it's also in the list of data elements further down in the manual. And then we have our references, and then our flow chart. So if you ever wonder why a mom has fallen out or has failed, you can follow your flow chart, and this will tell you exactly why a mom has landed in either in the population or not. So OBS 5, no changes for either OBS 5 or 5A in the measure information form and flow charts. Everything is the same as it was last year. And then again, we've got our numerator and denominator and our included populations and excluded populations, and our flow charts. So this is the flow chart for OBS 5, which is just the exclusive breast milk feeding. And then we have our flow chart for the observe and assess breast milk feeding, which comes in after the exclusive breast milk feeding. And it's a real simple one, you know. OBS 6 is the cesarean birth in the first-time moms. No changes to the measure information or flow chart here. So we'll just scroll through there real quick. Again, with the abstraction resources for those data element. Here's our flow chart. Some of these flow charts are way longer than others. OBS 9. We did do some changes to OBS 9 this year. We added some stillbirth diagnosis codes to the exclusions. And then we added the option to answer NA as well. And then I'll go over that here in just a minute. So if you look down in our excluded populations, we've included here the principal diagnosis codes Z371, 374, and 377. Those are stillbirth diagnosis codes. And if those are in there, those patients will be excluded from the OBS 9 measure. Because obviously, if a mom comes in and her baby is stillborn, we don't want to put her through teaching and giving her advice and education on how to breastfeed a baby that she's not going to go home with. So, and then here's our flow chart for that. We've included the changes here to reflect the stillbirth or not having the stillbirth codes. And then we've also added the NA in here. So if say a mom comes in and she does have a stillbirth, or it's an adoption, or the baby's going to foster placement, or any reason that a baby is not going to go home with the mom, you can answer option NA, and that's going to take them out of the population and you won't fail that measure. So, and we'll go through that again in the data element. Okay, tobacco. This is kind of a crazy one. The tobacco measures, last year, well, for 2 years now, this will be our 3rd year, we're using version 5.1 of the CMS specifications manual. And we're doing that to limit some of the changes that you guys have to do for the IQI program. I understand that, you know, the hospitals, you guys that do tobacco for Joint Commission, you guys adapt your medical records and your processes to go along with their guidelines. But for the IQI program, we've been doing tobacco since 2014, and we're not seeing a lot of improvement. So we're trying to get you guys used to our process and get this going so that we can see some improvement in some of these measures. So we haven't made one change to tobacco this year. It's exactly the same as it was last year, and it's exactly the same as it was the year before. So with that, so we've got tobacco 1, which is tobacco use screening, tobacco 2, which is tobacco use, it's the medication and practical counseling in the hospital, and then tobacco 3, which is medication and referral at discharge. So no changes to those. So I'm just going to jump. Instead of scrolling through all of those pages, I'm just going to jump down here. So after the tobacco measures, we get down to page 52 of the manual, which is our BHS1, our Behavioral Health Services measure information. And this measure is suicide risk screening in the hospital emergency department. Like I said earlier, we've changed this to include your emergency department population. And the description is that we're looking at patients screened for suicide risk during the hospital emergency department stay or visit. There's some rationale there that we've added for you guys to see why we're looking at this. Our numerator are our patients who receive suicide risk screening in the emergency room. And that's our only data element, basically, for that. Our denominator are our patients who are in the emergency room. So for that, we've got any patient age 8 years or older and patients who are seen in the emergency department. So it's a huge population, and that's why we're allowing you to sample this year on that one. The excluded population are going to be those who expire in the emergency department, those that are less than 8 years of age, and those who leave against medical advice. Your data elements, other than the suicide screening in the emergency department, We've got a birth date, an EM code, discharge code, and ED patient. All of these are included in our alphabetical data dictionary here toward the end of our manual, along with the other elements for the OBS 5A and OBS 9.
Hey, Robin.
Yeah.
This is Josh over at County Regional. So are you saying that this year we're just collecting like benchmark data for that measure? This isn't one that's going to be like counted against us?
Yes, this is a submission measure. So
Gotcha.
What we're doing is we are abstracting it and we are submitting it and validating it. But as long as you do those things and you pass validation, you're going to pass it. And then this is going to give you your baseline score for next year where you're going to have to perform. And then,
Gotcha. Thank you.
Okay. You're welcome. Let's see. And then we have a flow chart for this one. It's a simple one. They come in, they're either 8 years or they're not. They're either in the emergency room or they're not, and then they're eligible. So this is our population. So if they're in our population, then we go down and then we find out where they went at discharge, if they were screened or if they weren't. And for this year, we're just doing the screening. So all you have to do is screen. Next year, we're probably going to look at some kind of follow-up to just add another, maybe a BHS2, which would be some kind of follow-up to this. But for this year, we're just looking at the screening. And like I said, when I answered Josh, it is a submission measure. So we are just getting your baseline score ready for next year so you can perform. Dee, I see your question. Let me see what. Okay. So on behavioral health, we've discussed a trigger on the triage that would open the assessment for screening. Not everyone who enters with a broken leg is at risk. Right, and we understand that. Let's talk about that after this, because I'd have to have Steve and Michelle with me to answer questions like that. Right, Dee, I understand. We'll talk about that after. So before I go on, does anybody have any questions on behavioral health other than what Dee just asked? And I'm going to talk to her about that later. No? Y'all make my life easy. Okay. So we'll move on to OP10. Basically, it's the same as last year. No changes that we made. And down here is the link where you can get all of the detailed information for that measure. Just click on the link and it'll take you to the CMS specifications manual, and that will take you to everything that you need. OP10 is our claims-based measure, so you don't have to do any abstraction. You don't have to do any kind of data collection on our end for this. We just look at your claims toward the end of each quarter. And it does take us a while because we do have to wait and make sure that enough of those claims have been submitted so that we can see what's happening. And I know that it's kind of frustrating for you guys because you're like, well, if we don't know what we're doing, then we can't improve on it. And we do understand that. But we do want to make sure that we have a number big enough to show you what you're doing. So that's why it takes us longer to get those results during the program year. OBS 8 and OBS 8 and HIV 1 are your structural measures. My note here, we haven't made any big changes to these. We've just kind of made them where your questions are a little more detailed. And we are going to collect these quarterly this year, and they'll have a quarterly submission deadline. So like when third quarter abstraction is due, your third quarter OBS 8 and HIV numbers will be due. That was a little kind of vague last year, but we kind of drilled down on that this year and made it a little more detailed. So basically what we've done here is your OBS 8 is your depression screening and pregnancy, and these are your patients who deliver and are screened for depression during the hospital stay. Your numerator is going to be the total number of patients who delivered and were screened for depression during the stay, and your denominator is going to be the total number of patients who delivered, period. And then we'll have your timeline posted to AMARC, just like we do with your third quarter and fourth quarter abstraction timeline. So that's the same here for HIV-1. We just made your question a little more detailed. What was the total number of patients with documentation of HIV status prior to delivery? And then for your denominator, what was the total number of patients who delivered? So,
Robin.
Yeah.
Hey, this is Mike Wisely at JRMC.
Yes.
Hey, I don't even remember now what we ended up doing, but on that structural measure, it was a little confusing, or from what I remember, the denominator, the number of deliveries, but yeah, getting that number we had didn't match the number of abstractions.
Right.
So I forgot which number we're supposed to use.
You can use whichever number you want. Here's again the thing with that. We look at your Medicaid paid claims, so that's going to be different than what you have in your hospital, because you're going to have more deliveries than what we're going to see. So as long as your denominator is more than or equal to what your OBS mother number is, it's acceptable. Does that make sense? So like
Yes, thank you.
Okay. Any other questions on any of the measure information? Okay. I don't know if I do my job really well or really bad, but I'm going on the really well side today, y'all. Okay. So we'll move on to data element abstraction resources. So like I said earlier, for the tobacco measures, in the measure information forms, we had in each of those, you had your list of data elements. Here is your list of data elements for the tobacco measures. And here's the link that will take you straight to the CMS specifications manual. So that you can abstract those questions. So I'll show you what that looks like. So once you get here, it takes you to version 5.1 of the manual that we're using. So all you'll have to do is scroll down and go to alphabetical data dictionary right here. And you click on that and open it. I tried to get it to go straight to the PDF, but I couldn't get it to do that. So eventually it will open, I promise. And then here's a list of all of those, but you'll only abstract the ones that you need for tobacco, and you'll see those in your list. So, and then if you scroll down a little, these are your data elements for your OBS mother and OBS newborn, and this link will take you here. And then so you'll just look through here and pick out the data element that you want to abstract. Because some of these measures are not CMS or Joint Commission measures, we made our own data elements for you guys, and we have those in this manual. So our first one is going to be breast milk feeding, observe and assess breastfeeding for OBS 5A. And this is the documentation that qualified hospital staff observed and assessed breast milk feeding. You have your question, is there documentation? And you answer yes, no, or NA. And the NA option, the mother chose to not breastfeed during the stay. I put a note here. If the mother does not even attempt to breastfeed during her stay, you can answer NA here and not fail this measure. Because if she doesn't even try to breastfeed, then you can't observe it and assess it. So that's not, that shouldn't be something that you're counted against. So if she doesn't even try, always enter this NA so that you don't fail this measure. Now, if she does try, but she chooses to go ahead and formula feed, and there's no documentation that anybody was able to observe her and assess her with the breast milk feeding that she did do, then you need to answer no. And this is it's not a really strict documentation thing. Just any kind of documentation that they saw that the baby had a good latch, you know, anything like that is qualified, but you do want it to be from your qualified staff, which includes your physician, APN or PA, nursing staff, your lactation specialist, or a direct patient care provider. If you have a latch assessment, that's sufficient. And then again, if the mother chose to not breastfeed during the stay, you can select NA to not fail that measure. And then some of your suggested data sources to look in for that: nursing notes, lactation education, patient education notes. We've got physician history and physical here, but haven't seen a whole lot of observing and assessing breast milk feeding in the history and physical. I've seen it a lot in the nursing notes and the progress notes, and some in the discharge. So anyway, those are just some sources for you to look in while you're trying to find that documentation. And then we move on to the breast milk feeding, provide advice and instructions to the patient. This is collected for OBS 9. And this is documentation that the mother received breast milk feeding assistance or instruction from qualified hospital staff. And this again is a yes, no, or NA question. If there is documentation that the education was provided, you answer yes. If not, you answer no. Now, in here, this just says, in the event of stillbirth, adoption, or foster care placement, select option NA. I put a note over here that any documented event where the mother will not be going home with the newborn is acceptable to answer NA and not fail the measure. So say the mom's going back to jail, or just anything, that the mom is not taking her baby home. The mom is transferred to another hospital, or the baby is transferred to another hospital. I mean, you could probably still do breastfeeding education on that one, but, you know, just any kind of documentation that this mom is not going to take her baby home will be acceptable for this NA option. Again, qualified hospital staff includes your physician, APN or PA, your nursing staff, lactation specialist, or your direct patient care provider. And your suggested data sources, again, are listed here. This is a new one, the discharge code. This is for your BHS 1. Basically, this is the final place or setting to which the patient was discharged from the outpatient setting. This actually comes from the CMS specifications manual. We just pasted it in here for ease because of the BHS 1 measure. Here are your options. And then there are some notes for abstraction here that you guys can read through to determine how you want to answer that question. And then it has your suggested data sources as well. And the ED patient, this is one for your BHS 1. Says that your definition here is patient received care in a dedicated emergency department of the facility. You've got yes or no. Either they were, they weren't, or it's unable to determine from the medical record documentation. And you want to read these notes for an abstraction, because some of this stuff is good to know, like this emergency department. These two, I had to really read these to make sense of them. So when you're reading through here, be sure that you look at this one when you're abstracting for these BHS questions. Your suggested data source is your emergency department record, because that's the only thing that you want to be able to use that. Your fact sheet or your registration form, because this isn't for your inpatient, so you always want to look at your emergency room stuff. There are no inclusion guidelines for abstraction. And any exclusions, we've got your fast track ED, any terms synonymous with urgent care or urgent care. So if there are any of those things, then they're not included in this ED, so you would answer no to that. Suicide risk screening in the emergency department. Is there documentation that the patient was screened for suicide risk during the hospital emergency department stay? Yes, no, or NA. The NA option here is if the patient refused the screening or there's documentation of cognitive impairment. These notes for abstraction, if you go through here, it must be completed by a physician, APN, PA, or registered nurse during the emergency department stay. Let's see, if they refuse the screening, you answer NA. If there's documentation of any examples of cognitive impairment below during the emergency department stay, select value NA regardless of conflicting documentation. So if there's any documentation while they're in the emergency department of altered mental status or any of these other descriptors here, then you're going to answer NA in that. And then your suggested data sources in is your emergency department record. So any questions on this manual's alphabetical data dictionary?
Robin, it's Denise at Baxter Regional. I have a question for you on the OBS measures where NA is a possible answer.
Yes.
Are those considered, if they're NA, are they exclusions, meaning they're not in your numerator and not in your denominator?
They are not in the measure population, I believe. Let me go up here.
Oh, that makes, of course, yeah, not in the measure population. Okay,
They're not
that
in
makes
the
sense.
population. So, yes.
Yeah. All right, thank you.
You're welcome. Anybody else?
Hey, Robin, this is Sean at Mina.
Hey, Sean.
Is there a place where we can see examples, or are there certain questions that we need to ask for the suicide screening?
I don't have anything right now, but I can send something out.
Okay, yeah, I have no idea what to build into our EHR for the suicide screening.
Okay, I'll get you some information.
Thank you.
Mm-hmm. Okay. What I'm going to do now is go to the Joint Commission alphabetical data dictionary and go over some of these changes that are in here for you guys real quick. The first one is going to be on gestational age. Some of these are just kind of worded different from last year. They mean the same thing. But for gestational age, if you go and you look here, it says the delivery or operating room records should be reviewed first for gestational age. Documentation of a valid number should be abstracted. Last year, it did like that this delivery operating room should be reviewed first, and then if you don't find it there, you go to another data source. It's a little different this year. So it wants it to be a valid number, and then if you go to the next one, it says if the gestational age in the delivery or operating room record is missing, obviously incorrect, or there is conflicting data, then continue to review the following data sources, starting with the document completed closest to the delivery until a positive finding for gestational age is found. So instead of just going in priority order of these forms, now you're going to look at which one is completed closest to the delivery of the newborn. So your H&P, your clinician admission progress notes, your prenatal forms, or your discharge summary. And then this next one, your gestational age documented closest to the time of delivery should be abstracted. That does not include the newborn exam. So that's the change there on gestational age. And then our next one is going to be on prior uterine surgery. They added, let me find it. They added an actual note here. Prior, is there documentation that the patient had undergone prior uterine surgery? Yes or no? Well, they've added here, in order to select yes, the current episode of care must contain documentation of one of the included surgeries below. An inverted T or J incision would be acceptable only if there's also documentation that the incision extended into the upper uterine segment. So To be able to answer yes to prior uterine surgery, a patient has to have had one of these surgeries right here in this inclusion list. Low transverse C-section is not included. Prior C-section without specifying that it's a classical, which is that up and down incision. The history of ectopic pregnancy without specifying, I guess that's cornual ectopic pregnancy, or history of cerclage without specifying transabdominal. So these things are excluded. So any of these will not count as a prior uterine surgery, only these cases over here. So this note right here is what is new for the prior uterine surgery data element. Everything else is the same. And then on labor, it has, looks like nothing changed on labor. But on history of stillbirth, we do have a change. They added a note for abstraction here for the, is there documentation that the patient had history of stillbirth? If there's documentation in the medical record of a prior pregnancy resulting in stillbirth, fetal death, or intrauterine fetal demise occurring at 20 weeks gestation or greater, you can select yes here. They didn't have any notes for abstraction last year, so adding this in is new, and it may make some changes for this year. And then let's see, term newborn. I don't think there's a change here, but I wanted to make a note of something. On the term newborn, the question is there documentation that the newborn was at term or greater or equal to 37 completed weeks of gestation at the time of birth? This note right here, in cases when there's conflicting documentation, example, both term and gestational age of 36 weeks are documented, the gestational age takes precedence. So if there's documentation in these sources that says term, newborn, term newborn, and then you see one that says gestation age 36 weeks, you have to go with the 36 weeks and answer no, that the newborn was not term. And then just kind of go over again gestational age. When you're looking at gestational age, if a newborn is documented at 36 or 35 weeks and 5 days, this newborn is at a gestational age of 35 weeks. Okay, he's not at 36 weeks. So we're looking at completed weeks of gestation for gestational age. So just remember that as well, that we want completed weeks, not the week plus, that has a few days in it. So those are all the changes that I see to the Joint Commission OBS mother and newborn data elements. Do you guys have any questions for those? No? Okay. Well, we'll go back to our specifications manual. Our Appendix A. This is where we have our diagnosis and procedure code tables, VHS 1 diagnosis code tables. This is where you're going to find your EM codes for your emergency department encounters. These are basically your CPT codes. Your OBS diagnosis code tables. These are all of your code tables that include your, if you want to see if a mom is included or excluded for either of those measures, or if your newborn is included or excluded for either of the breastfeeding measures. These are your table numbers. You can just click on this and it will take you to your specs manual, the Joint Commission specs manual for those. And then your tobacco diagnosis code table, your exclusions of your pregnancy codes are here at this link. So the NICU question for the OBS 5 exclusive breast milk feeding was the newborn admitted to NICU during the stay. These are the only hospitals that we have documentation of that are a qualified level 3 NICU. If your facility is not on this list and you do have a qualified level 3 NICU, send me documentation of that and we'll get you on this list. If not, you cannot answer yes to the NICU question for breast milk feeding. That question is sending the baby to NICU is not having a C-section baby and just sending them up to the NICU for a little extra oxygen or just as a transition period. This is for life-saving care is what we're looking for when we ask that question. And then our tobacco approved medications. If you go to this link here, it will give you all of those approved medications that you can answer yes, that the patient received one of these tobacco cessation medications either during their hospital stay or at discharge. And then our references of where we get our information from. And so that's the end of our specifications manual. Do you guys have any questions about the manual? No? Okay. Well, when I sent out the calendar invite for this training call, I had mentioned that if you had any questions you would like to have answered on the call to let me know, and then I would do that. And I did actually have a couple of questions come through. So let me open this. I should have opened it in the beginning. My first question is an exclusive breast milk feeding question. If the mom is breastfeeding, but the baby has episode of hypoglycemia and MD orders glucose water, will that cause failure of the measure and why? So I went to Joint Commission on this one. Any of these kind of questions, I always go to the Joint Commission and ask them. And they came back with, if the newborn receives any other liquids, including water, during the entire hospitalizations, select allowable value no for exclusive breast milk feeding. But if you're using glucose 40% gel, it can be considered a medication and not a feeding. This should be reflected as such in the documentation, and you could abstract yes. Another question that I got was for OBS 9. If the mom's baby is ill and has to be transferred to another institution and they did not receive breastfeeding education, how will this be addressed to prevent failure? And then this goes with that NA option. This year we've added an NA option to this measure to include stillbirth, adoption, and foster care placement. It's not an all-inclusive list, but I believe this situation would be an acceptable answer to NA. To not fail the measure. A tobacco question. Why does the question regarding tobacco cessation medication not gray out on patients who are light smokers or who are using snuff, cigars, chewing tobacco? And in the CMS specs manual, it's used to state that those patients did not need to be given tobacco cessation medication on arrival or at discharge. The new AMARC tool did come with some limitations, as you guys know. Skip Logic was one of those this year. I'm hoping, I have a meeting with him Thursday, and I'm hoping that Skip Logic is going to be able to be addressed this year. But light smokers and those who use smokeless tobacco are not required to be provided medication during the stay. So you can skip if you want to. If you know how to follow your flow chart, you can skip those questions. So like if you have a light smoker and you know that they only require the counseling, you don't have to answer the medication questions. Just answer the questions that you're required to answer. And because I do the same. So that's an option for you guys, but I really am hoping on Thursday when I get a chance to meet with them that I can find out if this skip logic is going to be able to be incorporated this year, since he doesn't, number one, he doesn't have to build the tool, and number two, we don't have that many changes. So hopefully it's something that can be added, and it's not just something that Salesforce won't let us do. And then our last question was a tobacco question as well, and it says, will we still exclude those patients who are here for only one day? Yes, those patients are still excluded. We excluded those on our end this year, again, with those limitations of AMARC. They were there, in your tool, but we did take those out on our end. So yes, those are still excluded because we didn't make any changes to our population or anything. So yes. So that is all I have, you guys, unless you have questions. How do you save the measure if you don't answer the question? You should be able. Does it not let you save if you don't answer all of the questions? I'll ask him about that, Charles. I'm writing it down.
Hey, Robin.
Yeah.
Okay, do you know when the charts will be, when we'll start seeing charts in our AMART account?
That happens in October.
So we won't see anything until October.
You're not going to see anything in AMART until October.
Okay.
Go ahead.
Go ahead, I'm sorry.
I was just going to say, I'll be sending out, the first thing you'll see from me, the next thing you'll see from me is your baseline threshold reports, participation and registration information, forms that you'll need to complete and send back to me if you plan to participate this year. And then in October, we'll start putting out that monthly list of cases to abstract. And October, we'll put July. November, we'll put August, and so on. So each month you'll get, July, August, September, October, November, and December. But that'll start in October.
Okay, thank you. And do you know when we'll know if our validations are approved, the ones that we just sent in?
I am trying to get them to get that wrapped up this week. So I'm hoping to get results out to you guys next week on that. That's my plan. But, my plan can only go so far.
Okay, thank you.
You're welcome. Hey, Charles, just to get back to you on your question about will AMART save the case if you don't answer all the questions? I'm hoping that we can figure something out with that in our meeting on Thursday. And maybe before we get started in October, I can do some kind of maybe recorded something to send out to you guys, or some kind of something so that you guys will know what to expect with AMART this year, any updates or anything with AMART this year. So hopefully we'll be able to. Anybody else? Let me see what we got in our chat box over here. Dee, I will email you when we get off of here so we can carry on about your question. And Charles, I got your question, and I'm gonna work on that Thursday. Okay, Teresa, threshold rates, hopefully in the next week or two. I hope to be sending those out. Stacy, I'll get this version of the manual out. I'll send it to everybody. If you don't want it, just delete it. But I'll send it to everybody. That way everybody has those notes. And if nobody has any other questions, I guess I'll let you guys go so you can carry on with your day. All right. Well, thank you guys.